talking about a dominant female hormone, estrogen. But a men's specialist doctor joining us to explain why men need estrogen too. Our time right now, 7:23.
Everybody, although some of us men don't like to admit it, we actually do have estrogen. That's the so-called female hormone. A new study out there shows it's more important than we may think, such as keeping our weight in check and being able to function sexually. Dr. Mary Montes, a men's health specialist at DeRosa Medical, is joining us here to explain why we have estrogen.
Well, actually, men and women both have estrogen. Ideally, a man will have about 95% testosterone and convert about 3 to 5% of that to estrogen.
Okay. And how does that change as we get older?
As we get older, generally testosterone will decrease. And what this study was looking at is that with the decrease in testosterone, you oftentimes have a decrease in estrogen that can have some issues with libido and weight gain. However, we also know that a lot of men actually excessively convert testosterone to estrogen and actually have too much estrogen, which can have some risks with it as well, like cardiovascular disease, and also maybe more emotional, a little irritable, and also maybe extra breast tissue, some fatty tissue. So it's really important to look at a ratio and not just the number.
So how do you know that you might have some estrogen, testosterone issues compared to, say, just drinking a lot of beer or eating a lot of bacon, things like that, or just being moody because of work or family life? I mean, you know what I mean? How do you know the difference?
I think, first of all, you have to sort of know what the symptoms are. So, like, if you're finding that you're more anxiety, a little bit more in depression, maybe your exercise tolerance has fallen, your libido's down, that waistline's expanding, those are all signs that it could be a little bit of a hormone imbalance, too. Ultimately, going to your doctor or a hormonal specialist to get the ratio done is how we objectively can diagnose it.
And how do you bring those levels back to where they should be?
You know, there's a lot of different treatment options out there now for hormone replacement. Everything from injections, pellets, creams, things like that. So
you can get back, and otherwise, if it goes untreated, how does that handle in your life?
You know, testosterone actually does a lot of things for men, as does estrogen, but people can notice they have a little higher susceptibility to insulin resistance, which is like a pre-diabetic symptom. Testosterone levels decreasing can also cause cholesterol to go up. So men also have lowered libido, anxiety and depression a little bit more, and that muscle mass tends to decrease over time as well.
And how do you diagnose this?
Generally a lab test. We have the subjective complaints that patients would come into the office with, and then we would get some lab work to objectively give a diagnosis.
Interesting. All right, Dr. Montes, thank you very much. Really appreciate coming in and talking to us about this.
No problem.
All right.